Our next professor is Professor Tang from the sixth affiliated hospital of Sun Yat-sen University and in IBD Center. 唐教授。
Thank you, Professor Iacucci. The lecture is very fascinating, and we know AI can, in multi-omics assessment, AI is very impressive. I have a question for you. In our clinical practice, patients know how to use AI. In China, we use DeepSeek. Patients will upload their medical record to DeepSeek, and they come to DeepSeek for their medical advice. The DeepSeek will maybe DeepSeek or other AI models will give them medical advice to choose how to choose two drugs, and it's always confused, make the patient confused, and they will talk to the doctors why you choose these drugs, and the DeepSeek or other AI told me that we may choose other drugs. So my question is, can AI actually guide IBD treatment strategy in this moment, in doctors or in patients?
I think we are working on this, but I don't think we are ready yet. It's again, it's the same concept. I think we are trying to attempt, but then I'm aware there is not tools then they have been approved to be used. And we need also to understand probably the AI can help, but we can't replace completely our approach in treating patients. So definitely, probably we will have in the future, which is not far away, like you said, some tools. Then you can, include, add some important, clinical data, and then the AI can predict and say, use also your brain. Maybe you have these two drugs, they can be good for your patients, but definitely it's not some things then I'm aware then is in the daily practice used yet.
Okay, thank you. And do you think you suggest our patients to use AI for the second medical opinion? Do you suggest your patients to use AI?
I think the patients, everybody, I think, use chat. Now it's quite. Me there, I had, sometimes I have some plans, they're not working very well, or I ask, but, you can't prevent the patients to use the AI because everybody use. But you should tell the patients, then maybe give some information, but they're not perfect, this information, and the doctors still revest, it's an important role, no? I don't think they can ask any second opinion. Definitely they can challenge you now because maybe they come to your clinic and ask you more questions, and you need to get prepared because I think, chat definitely, I'm saying, I think it's getting better. And because we are feeding him. So this is what it is. But I think the patients, they come informed, but I don't think chat can be the second opinion.